Good morning, everyone, and thank you for joining us today for this important conversation. I am Lisa Richardson, Vice President of Advancement, Innovation, and Strategic Partnerships here at Pasco-Hernando State College. We appreciate you taking the time to learn more about an important issue affecting many Floridians, the impending expiration of the Enhanced Premium Tax Credits, otherwise known as EPTCs. These tax credits significantly reduce monthly health insurance premiums for people who purchase coverage through the individual marketplace. And without congressional action, they're set to expire at the end of this year. If that happens, thousands of Floridians could see their premiums spike overnight, putting their coverage and their health at risk. Today, we'll walk through what's at stake, what solutions are on the table, and how you can help urge lawmakers to extend these critical tax credits before it is too late. Before we get started, please take a moment to watch this short introductory video on EPTCs to help ground our conversation.
Millions of Americans rely on enhanced premium tax credits to afford health coverage. In 2024, these tax credits helped 24 million people get coverage, keeping healthcare accessible for working families, small businesses, and more. But these tax credits will expire in 2025 unless Congress acts. If they're allowed to expire, millions of Americans will face a tough choice: pay much higher premiums or go uninsured. Without coverage, many will delay care until emergencies, leading to overcrowded ERs and higher costs for everyone. The economic impact will be severe. But we can stop this crisis. Congress must act now. Tell Congress to extend the enhanced premium tax credits.
And now I would like to introduce our panelists who will guide our conversation today. Brewster Beavis. Brewster is the President and Chief Executive Officer of Associated Industries of Florida, a leading business association based in Tallahassee. Named President in 2021 and officially assuming the role in 2022, Brewster has been with AIF since 2011, previously serving as Vice President of External Affairs and later as Senior Vice President of State and Federal Affairs. Next, I would like to introduce John Learn. John is the Government Relations Manager at Baycare Health System, where he has served in various government affairs roles since 2021. Prior to joining Baycare, he has worked as a legislative aide in the Florida Senate and as a finance assistant for a congressional campaign. And next, we have Sally Seymour. Sally serves as Chief Executive Officer of HCA Florida Bayonet Point Hospital, bringing more than 20 years of healthcare leadership experience. She has held executive roles at hospitals across Florida's West Coast, including in Pinellas, Pasco, and Charlotte counties. Next, we will begin our discussion. So today, we are talking about an issue that will touch the lives of tens of millions of Americans, and yet almost no one has heard of it. Enhanced premium tax credits are the best kept secret. in public policy. And we're here to change that. As you're all aware, small businesses are the backbone of our economy. But without affordable health coverage, many cannot survive. For years, entrepreneurs whose firms were too small to offer group insurance had no realistic option. That changed in 2021 when enhanced premium tax credits, or EPTCs, guaranteed that marketplace premiums would never exceed 8.5% of household income. Since then, millions of small business owners and employees have slept easier knowing they are protected if they get sick or are injured. To start us off, EPTCs have helped over 4 million Floridians access health coverage. From where you sit, why is access to affordable health care such a critical issue right now?
Would you like me to
I would love to.
answer that one?
Yes, please.
Can you hear me? Look, I think in coming from the association world, and looking at our budget every year, the cost of healthcare increases is something we look at every day. I mean, I couldn't imagine, being a small family out there and not having access to critical healthcare needs that you're going to have for your family as they grow. So I think having, this ability to have these tax credits to help fund in a private marketplace individuals to go out and get good health coverage and truthfully get them off of state-funded health programs like Medicaid and things of that nature is wildly important. I mean, look, I think, with what we've been seeing with inflation over the years, increased cost of goods and services on everything. I mean, health care costs are skyrocketing. And to allow and have this program out there is very, very important for small businesses, and most importantly for those families out there, these 4 million people plus in Florida that access these funds, to allow them that peace of mind at night. Look, if you've got a sick kid, that you can take them to a good facility, a good healthcare provider to get the help they need. And I think, that's one of the real important pieces and why AIF has been, very engaged in talking to congressional representatives and also state representatives to encourage them to extend these credits, because look, there's 24 million people across the United States utilizing them, 4 million here in Florida. I mean, just, pulling the rug out from under these people is I don't think going to be good, A, for the business, and B, truthfully too, for the state budget here in Florida, who, is going to be probably picking up the bill for a lot of these people who no longer have access to these funds.
Thank you, Brewster. Can each of you share one way you've seen health coverage or the lack of it impact your community or those you serve? Maybe we could start with Sally.
Sure. I see it every single day. In the healthcare setting, especially in the hospital setting, you frequently see patients come into our emergency rooms who have advanced disease progression that truly could have been mitigated had they had access to affordable health care and gotten treatment prior to ending up in the hospital. And to see the toll that this takes on not just the patient, but their families, the emotional toll, the physical toll, the economic toll that it takes on all of them. And I will give a real-world example that we all recently lived through. When I think back to COVID and when our world shut down, you had people that stopped, despite the fact that they had health insurance at the time, people stopped accessing preventative care. And what we saw, at least in the hospital setting, was later stage cancers, because people had not gotten colonoscopies, had not gotten mammograms, later stage cancers that could have been caught had they had access to care and had they gone and done the preventative screening. And just, again, the toll it took on their families. So when I think about patients right now, like Brewster said, 4 million in the state of Florida. If I look at the area that we're located in, Pasco-Hernando up to Citrus counties, that's 93,000 lives. those patients potentially having care today or having, access to care today through the Affordable Care Act and EPTCs waking up and having premiums that skyrocket that they can no longer afford, I think we'll see what we saw during those COVID years where people stop getting access to preventative care and end up with disease progression and more advanced states of whatever they're fighting. And I really think it's going to be a significant issue that we're going to see in the future.
Yeah, I think, you hit the nail on the head. It really is about, we know outcomes are better across the state, across the country when folks have access to that preventative care, and acuity post-COVID has gone up. So if these were to go away, people are not going to be getting their routine clinic visits. They're not going to be presenting, and they're going to be using the ER as healthcare, which I think contributes to higher costs for the healthcare system, which all consumers, everyone will have to deal with. Increased wait times in the ER, which is something we know we grapple with in Florida already. And it's not the best place for them to get that care. It's to manage their disease, right? When we think about diabetes, if somebody doesn't have an ACA plan that's subsidized by the EPTCs, potentially they're getting into a situation where they're suffering from diabetic shock, right? And because they're not managing that chronic condition. So I think those populations the most are probably who we have the most concern around, that have a manageable chronic condition, but don't have necessarily a way to pay for it. So those are who we're concerned about losing the coverage because they can't simply afford it, and then having nowhere to go. And I think Brewster kind of touched on Medicaid a little bit. Medicaid in Florida really doesn't cover a lot of folks. The state has opted not to expand, and I think that's a reality we have to look at. But also, there's not broad eligibility for other folks. The reimbursement isn't great either. So it's something not necessarily a lot of providers take Medicaid across the state as well. So I think that's a limitation when we say, well, Medicaid can pick some of these folks up. Not necessarily.
Yeah, and I think, looking at it from the broader lens of the entirety of the Florida business community, look, if these go away, you're going to have a lot of people simply just going bare. I mean, for a family of four earning $64,000, their health premiums are going to go up about 200%. A lot of them are going to decide to go bare. And I think one of the largest drivers of cost in our healthcare marketplace are people utilizing the ER as their primary care doctor. And the ER is not built for that. I mean, getting these people losing their policies, losing their primary care doctor, and utilizing an ER, which is one of the most expensive forms of healthcare, is going to drive up the cost of healthcare for all businesses. It's not just businesses whose employees may be utilizing these tax credits. It's for businesses like mine who pay for a large portion or pay for all of their employees' health care premiums. The cost of health care for everybody will go up because, look, if you've got a balloon and you push it in, the balloon's going to expand over here, right? Well, somebody has to pay for the potential new uncompensated care influx into our healthcare ERs, and that is going to be borne by and shouldered by businesses who are paying into their employees' healthcare premiums, because those premiums are going to go up, not just for these individuals utilizing this tax credit, but it's going to go up for everybody else, because the cost of healthcare in the state of Florida and across the nation is going to skyrocket.
Thank you. We know that many people still haven't heard of EPTCs. So how do we make this issue real to them?
I'm happy to kind of jump in on that. I think, going out there and talking to some of these companies, 82%, I think, of the users of this tax credit are small businesses. Going out and finding these small businesses, targeting them to talk about, what is provided for their employees. My wife has a small business. She doesn't provide health care for her employees. But I think going out and doing a marketing campaign to discuss this issue with them, because I think once people learn about it and once businesses learn about it, more people will start utilizing it than the current 24 million. I think one of the problems you have is that within a lot of small businesses, there was this inherent distrust and dislike of the term and the program Obamacare. This being a part of that, and I'll say this, when I lobbied in D.C. for a construction trade association, we threw everything we had at trying to stop Obamacare. Now, however, it is law. I think, everybody is, dealing with the hand that they have been dealt. And I think, one of the problems in getting some of these small businesses engaged is a lot of these small businesses from day one thought Obamacare was going to increase their costs. I don't think that is the case. And I think it's changing that mindset with a lot of these smaller businesses who really do utilize these tax credits and informing them that this is a good thing. This can save your company money and, more importantly, provide you with a healthy workforce. Because as a small business, and my family is in a small business, my father owns funeral homes, your employees are your greatest asset, and they're like family to you, and you want them healthy, you want their families healthy. But I just think getting out there and talking to these companies and these employers about this program is the best way to really get them in tune with what is being offered to them.
I would add, I think having these conversations in a public forum, I think it's a grassroots campaign, to be quite honest with you. We're operating in a time where there is a tremendous amount of political unrest. There's a lot of noise out there, so I don't think this issue is rising to the top. I think it's having these conversations, making people aware, providing examples like the one Brewster did in terms of how much these premiums could potentially increase by. And when I look specifically at our county, at Pasco County, there are not a lot of large businesses in Pasco County. We are a small business community, and a lot of our businesses rely on this to have their employees covered. So I think it's keep the conversations going, direct people to websites like Keep Americans Covered, where they can get more information and to figure out how they can get involved, and reach out to their representatives to let them know that this is an issue that's important to them and it's something that matters.
Yeah, I think to just add to that, there are a lot of people that don't know that they're benefiting from the subsidies necessarily, or the EPTCs, and I think there's a step there where the plans, reaching out to their members and saying, look, in the next year, if this doesn't happen and they aren't extended, your premium is going to go up X amount, is what we project. And I think that messaging is important. I think us communicating to our patients, as I know we do when these changes are coming, and making sure they're aware of what changes there might be, and if there's a local county healthcare plan, which I know Pasco doesn't have, but some other counties do, as an option, like where else can you get coverage? But I think, to Sally's point, once we pass reconciliation and some of these other things going on in D.C., this is on a lot of folks' minds. In Congress, in the U.S. Senate, they know this is a decision, this is something they're grappling with, but it's very much okay, let's finish this, let's get past what's going on right now, the current situation. They've got to increase, the debt limit for the country. So once those things are past them, I think this is very much that next conversation, and I think there's bipartisanship from our community and across the country, too, that can hopefully extend these.
Thank you. How can local leaders in healthcare, business, and education partner to ensure nobody falls through the cracks?
I'm going to kind of refer back to what we talked about previously. I think it's a grassroots campaign. I think there is, it's challenging to find information and to find the right information and figure out what plans you're eligible for. I know both of our companies, when somebody gets admitted to a hospital, we're fortunate to have resources in a case management department that if they do not have insurance, they will work with them to find out what plans they may be eligible for and walk them through that process. But I would argue at that point, it's already too late because you've already had a hospital admission. So the more we can reach out, the more our small business community can reach out and let people know what options are out there. And again, I think right now it's not just making people aware of the fact that they can buy affordable health plans on the exchange. It's again letting them know that we need to continue with enhanced premium tax credits, because if those expire at the end of this year, then that subsidy is going to be passed on to the consumer, and it's no longer a really affordable option for them.
I think we live in a community, too. We're really fortunate to have great providers across the greater Tampa Bay region. I think the population growth in Pasco alone has shown, you've seen new hospitals come in, and so I think there's some understanding that there are hospitals that are going to be there that have, a not-for-profit mission, or that are going to take care of folks as they come in. But to her point, they're coming into the ER and we're getting them there instead of them having access to coverage. What are the downstream effects of that? Obviously, they're the healthcare outcomes, but when you talk about the cost to the system and people visiting through the ER, the state is going to have a role in helping cover some of those uncompensated care costs, but hospitals also then have to make some difficult decisions on, okay, our margins are tightening because we're having to care for so many more folks that have no coverage, and we're having to see this new population with the EPTCs potentially going away. So then it becomes, what services are we getting poor reimbursement from Medicaid from? So whether that's labor and delivery, which is something I think anywhere folks are moving, they're looking, okay, what's my hospital? Can I have a child there? That's a big concern. And I think state Medicaid dollars, half the babies in the state are born on Medicaid, and it's 48 cents on the dollar for coverage. So I think that's a big concern. Services like that, we've seen maternal mortality outcomes get worse across the country. I think we're really fortunate in this community, but if these go away, it's really immediate health outcomes for some folks, and then what will the system of care look like in the next 3 years after that, where we'll really start to feel some of those effects too.
Yeah, and I think, talking about who to talk to, I think, reaching out to your local representatives. I mean, I know this is a federal issue, but this is going to strain and put a additional cost on our state coffers. I mean, heck, we can't even put together a budget right now. And if you look at the long-term impact or the long-term projections of the state budget, that is dipping. And I think, adding this increased cost is going to be something that your local elected officials are going to deal with. And when you go out and talk to them, they'll immediately say, well, this is a federal issue. Well, it's not really, because if you have more uncompensated care patients coming into your ERs, that is increased cost to the business community. If you have more folks on your Medicaid rolls, that is increased cost to the state coffers. So really engaging them, and then also reaching out to the people who are probably unbeknownst to them, utilizing these tax credits through the plans. To, like Sally had mentioned, having these plans talk to them and send out notices to them that, your premium could increase 200%. That is astronomical for a small family who literally lives paycheck to paycheck to have to deal with that and have to make the decision, well, how are we going to get health care provided to my children or myself or my husband, if this goes away? Are we going to eat this 200% increase, or are we just going to go bare and utilize our emergency rooms as a primary care, which is, like I'd mentioned before, one of the biggest cost drivers in the state?
And Brewster mentioned that, yes, this is a federal issue, and a lot of times people might say, okay, federal issue, we don't need to pay attention to it. This impacts Florida more than any other state in the United States. Florida led the nation this past year in terms of enrollees into the Affordable Care Act. This is 4 million Floridians. This has a bigger impact here than it does anywhere else. So although it's a federal issue, we have to make some noise about this.
Yeah, and I think just adding on there, that's a really good point from the perspective too. Like, Florida's population is 9 million less than Texas, but we've got over 1 million more folks on these EPTCs and benefiting from ACA marketplace plans. So it is a testament to not just in Pasco County, but the small business community relies on these, and that's why you're seeing Florida outpace other states that have bigger populations utilizing these plans.
Thank you. So I have a very healthcare specific question now. As a hospital leader in one of Florida's growing communities, what changes have you seen in patient access to care since EPTCs were introduced?
It's interesting. EPTCs probably make up about 7% of my business at my hospital. We are a level 2 trauma center. We pull from a wide geographic area. We pull from 5 different counties, about 18,000 square miles. So it's not a huge portion of the business. But again, think about the patients and the families that have health care insurance on the exchange. These are healthy working families by and large. It's not our Medicare population, that's a little bit older and that you tend to see in hospitals a little bit more. So the biggest change I've seen is that we're able to get more patients covered. Patients that do not fall below the poverty level and qualify for Medicaid that previously went uncovered, we're able to get those patients access to care. And ideally what you see is them accessing care more outside a hospital system, which might sound funny for a hospital CEO to say we're trying to get patients qualified for a plan that keeps them out of the hospital, but I think there is a community benefit to that, and it's just the right thing to do for our communities. We also, I think it was mentioned, I'm not sure if it was Brewster or John, but sometimes the state has to step in and subsidize that uncompensated care. So if somebody doesn't have insurance, you still have an obligation to care for them. When they come in through your ER, you treat them, you admit them, and you give them what they need. We actually, there are certain payment structures from the state that can help cover that cost. My hospital no longer qualifies for it because we have been so successful in getting patients covered with the Affordable Care Act that we do not have that disproportionate share of uncompensated care anymore, because I think we're doing the right thing. And I don't think this is unique necessarily to my hospital or my healthcare system. I think it's universal across the board that we're trying to get patients access to care and keep them out of our emergency rooms.
Yeah, I mean, without a doubt, she hit it. More people are covered. I think that's the talking point. And I think that means a lot for us as a hospital, and them having coverage, obviously, and us being able to keep our doors open, keep our facilities staffed, and a labor shortage that has perpetuated since COVID. But when we talk about people being covered, right, it's about somebody, and we grabbed a few examples, an older man in his 50s who gets a liver cancer diagnosis, and he had been healthy to that point, but he wasn't carrying healthcare coverage because it was too expensive. So he comes in through our front doors, and then a navigator is able to help his system say, no, look, you do qualify based on your income level for an ACA plan with a subsidy, and now you're going to have coverage throughout your liver cancer and the treatment for that. And that's not something that can wait. And I think those examples are more so for that working class population you're thinking about, not the older folks. It's more for the people that simply just can't afford what the healthcare costs are for a normal insurance plan. And another example is a young kid. He's 25, so maybe not a kid anymore, but he's no longer on his parents' coverage, and he hasn't been paying for health insurance because he couldn't, and he has an autoimmune condition, and it's something that can easily be managed with coverage. So coming through the front door again, and financial navigators with the hospitals helping place them with that coverage. He's paying less than $50 a month. He's got the same doctors he had before when he was with his parents, and he can now afford his prescription on a monthly basis. So he's going to be okay. He's not going to come back through the hospital. So I think we see it from a kind of that system perspective for Baycare, where we know a lot more people in our community are healthy, and we know that's good for everybody. They're not coming to the ER. That means when you go to the ER, you have less time. But in those personal levels, we know that meant a lot in those lives. So I think that's the big impact of these EPTCs.
Yeah, I think for us in the business community, I mean, having a healthy workforce, getting these people back into their jobs as quickly as possible, because like John alluded to, not only in the healthcare space, in all businesses space, I mean, people need workers. Drive down the road, just about every business has a now hiring sign. I mean, if you have a healthy workforce, people who are getting back into the workforce quicker, that's good for the business community. And that's what we in dire need of right now, is a healthy workforce. And if you have people, workers and employees on these private plans, that they can go in, get the care they need, get back on their job quicker, that's good for the entirety of the Florida's business community.
Thank you. And I know in some ways we've probably answered some of these questions. I think it's just good to keep driving the issue home. What would it mean for your hospital and patients if these tax credits were allowed to expire?
Yeah, I think I can jump in on that, and maybe I'll take you outside of just the hospital brick and mortar, but something Baycare does a lot of is provide behavioral health care, particularly in Pasco County. So off King Healy, we've got a variety of inpatient treatment facilities, outpatient, and something we recently opened, behavioral health urgent care, right? So that's a pathway for where somebody that doesn't need crisis level stabilization but can come in and there's no wrong door entry. We're going to get you connected to outpatient services. We're going to get you connected to exactly what you need. That costs a lot of money, and that's something that behavioral health services writ large only lose money. So that's part of our commitment to the community, that we're going to go ahead and provide that care. I think when we talk about what could happen to hospitals, we're talking about that new behavioral health facility that we know is instrumental to this community. We know there's substance use epidemic and mental health issues as well that have only increased, and I think policymakers are thinking about that. So, and that's something we communicate. Look what we could lose going forward. Labor and delivery is kind of that other example. I think those downstream effects that we could see in the future, it's not necessarily day one where you'll see any facilities close, but what are the resources that our communities are not going to have or not have access to that they do need as a result of this change?
I agree. I don't think, like John said, I don't think it's a day one impact. I think it's what he alluded to before in terms of disease progression, us not preventing it, them ending up in an overcrowded ER. I go back to, again, I work at a trauma facility. We deal with life or death issues every single day. And so those patients are always going to come back first. The other patients that may be waiting in the ER because they could have had something that could have been treated in an outpatient setting, it's going to extend those wait times, overcrowd the ERs. And you brought up the resource constraints that healthcare has been facing for years now. There has been a nursing shortage for the last decade. COVID exacerbated that nursing shortage. And it's going to take some time before we dig back out of it, partnering with PHSC, as we continue to grow new nurses. But until then, you're going to take a resource-constrained system and you're going to add more volume to it. And that is not necessarily a recipe for success that will benefit any of our community members.
So are there particular groups of patients, like uninsured individuals, early retirees, who've especially benefited from the expanded access under the EPTCs?
I don't know that it's specific patient types. I think this is, the Affordable Care Act is a pro-business solution. It allows the small businesses in our community to offer a healthcare solution to their employees at any age that didn't exist before, and that truly was not an affordable option for them as business owners. So I think it just gave them the ability to continue to do what they're passionate about, and then make sure their workers were taken care of and had a good solution. But I think this is something that's going to impact patients across the board.
Yeah, I think I would agree too. Maybe one subset of that is just folks that struggle to get coverage, that are chronically ill, that might have, as they're shopping for healthcare, premiums that are just astronomical, and they'll never even consider those plans. So I think that maybe is one subset of that. But to Sally's point, I mean, everybody in this community is benefiting from them. So it will the effect will trickle throughout, not just one subset or group necessarily.
Yeah, I mean, I agree. I mean, I think it's very important for the business community to realize that these currently are available and utilize those truly when they're going out and hiring individuals. I mean, that gives a business a leg up from somebody else to say, hey, while we may not provide you with health insurance, here is an avenue, and walk them through how to access these. I mean, like I said, there's a lot of people out there hiring. There's not a lot of people to hire. And if a company and a small business can grasp onto this and say, look, here's something I can help you walk through to provide your family with better health care in the private setting, I think for a business, that gives you a leg up over some of your competitors who are trying to hire the same individual you are. But I don't think it hits one specific age group or type or anything like that. It's being utilized by 4 million individuals, and I think they're probably across the spectrum of ages and points in their career, maybe moving from one job to another. But I don't think it hits any specific age group or type of individual.
The only other thing I would add is, we've talked a lot about it, but when you think about the downstream effects of this, when you shift a care setting, and by that I mean there's been a federal law since 1986, the Emergency Medical Treatment and Active Labor Act. So every single patient that comes into an ER, regardless of what hospital or what ER in the country, every single hospital has an equal obligation to provide a screening and stabilizing treatment for that patient, regardless of their ability to pay. So every single hospital sees their share of unfunded patients. That is going to increase. So when I think about our primary care physicians, people that are building a business off of preventative medicine and serving the patients in our community, if those patients are no longer going to those primary care physicians and are now using an emergency room as their option to receive care, I'm wondering what the downstream impact will be to those primary care settings. Are you going to see businesses that are currently thriving no longer able to continue to operate? Are we going to see a change in urgent care centers, another great opportunity for patients to access care? Again, all of these businesses require a patient to pay for services. Hospitals are the only thing left that still will have to treat patients regardless of their ability to pay, and I just don't think that formula makes a lot of sense if we're looking towards the future.
Thank you. Oh, so what are you hearing from your members about the value of these tax credits, especially in a competitive labor market?
We're hearing from our members who, and look, we have a lot of very large members. We have some small members. Our members are saying that, look, their biggest concern with these going away is going to be the increase in the cost of healthcare across the state. I mean, not just for the people potentially losing these plans, but for everybody else who is going to have to pick up an increased cost for everybody else. And I think, all of them, when we talk to them and say, what keeps you up at night when you're going through your books? And it's the rising increased cost of healthcare. And I think, whether people, their employees are utilizing this or, like Publix, who is funds their own healthcare programs, they're going to see an increased cost across the board. So it's not just for these small businesses who have employees utilizing this, which is 85% of the participants down here. It's increased cost for everybody. Increased cost for my association is going to go up because we will be paying these increased costs. I mean, it's going to be spread across the entire spectrum of the business community. So that's what we're hearing.
Thank you, Brewster. From a business perspective, why is access to affordable health coverage like what's provided by EPTCs so important to Florida's workforce?
Yeah, like I had mentioned, I mean, having healthy employees is important to your business. Having employees who show up, having employees who aren't calling in sick every other day because they cannot get the healthcare needs, the healthcare they need. So I think, having your employees, a healthy workforce is a workforce that is producing more, is coming in on time, is not having to take a lot of sick days off for themselves or their children. And look, all of us run a business or are part of a business in some form or fashion. When you have a lot of employees who are sick, who are not getting the care they need, it hurts your business. And a lot of these businesses, are barely making ends meet as is. I mean, they need employees. Their increased costs of their labor is increasing, their increased cost of materials is increasing, and their cost of healthcare is increasing. So having a good, healthy workforce that's coming in and showing up to work is very important to keep a business afloat.
Thank you. What long-term economic consequences might Florida face if EPTCs are not extended?
I think Brewster kind of touched on this. He talked about, at the state level, we haven't necessarily been able to pass a budget yet. There's been discussion about, cutting sales tax, property tax, what have you. So at the state level, they're very much viewing this through a vacuum, and they potentially would decrease revenues. But there's also been, in the last couple long-range financial outlooks at the state level, signs of a recession or signs of an economic downturn in Florida. And that might be 3 to 5 years away. But again, when we think about tax revenue going down, potentially, cuts to taxes as well, the state's going to have less money at the budget. And then what are they going to be cutting? And is it going to be health care? Is it going to be education? You're going to be paying more for tuition to go to university. All these different things are going to be connected. So I think if these go away and then the state's in a difficult financial situation, you could see deeper cuts to potentially Medicaid and compensated care programs. You could see, I think Florida hasn't increased university tuition for 10 years or so, right? Like, we've done really well on that, and that's been something that's helped us continue educating our workforce. So what could those other effects be? I think they could, span a lot of things with a state budget that's, $115 billion or so, about what they could cut. But I think we could see cuts at the state level too, which gives us a lot of concern.
Yeah, and I agree. I mean, look, this money and these tax credits and subsidies help fill a hole. If those go away, that hole has to be filled or removed. And John makes the good point of, like, well, where are they going to cut to remove it? Are they going to have to? They haven't expanded Medicaid. What are they going to do to help save that money? Because I can probably assure you, they're not going to just say, oh, well, here's some state money, go out and do good. And I think, that's going to be the problem that the state legislature is going to have to deal with if this is cut, is that there is going to be a hole. And where are they going to find the money to fill this hole? Or what they'll probably do is just start cutting and finding money elsewhere to fill this hole. And I don't think that's anything anybody wants to see, because, it's like a clown show up there right now. And if you add in a huge budgetary hole like is looming, they're going to be in a very strange position in the state.
And I think there's one thing that we need to clarify, and again, Brewster is much closer to this at the state level, and John is probably closer to it than I am, but having done some lobbying at the state and federal level, I think there is misinformation in regards to the Affordable Care Act is not going away. That is not set to expire at the end of the year. It's the specific enhanced premium tax credits that make these plans affordable for the consumer that will go away. So when we're looking at a lot of our representatives, I think there's a thought there that, well, this solution still exists, we're not taking it away. The challenge being, if there's no funds to fill that void that Brewster was speaking about, it's passed straight to the consumer. And again, we're right back to what we discussed about, where if you can't afford it anymore, if you are already living paycheck to paycheck and you are a 60-year-old couple that's making $80,000 a year and all of a sudden your premiums go up by $19,000, you stop paying it and now you are uninsured. And I don't know that anyone is truly prepared to deal with what the reality of that looks like when a large portion of those 4 million patients in the state of Florida are now uninsured.
Yeah, and I think Florida's made a lot of progress, and you can look at the previous Senate President, Kathleen Passidomo, who strove to make a lot of investments in healthcare in her Live Healthy package. And one of the big areas, right, we've talked about labor shortages. I think it's, 2035, Florida's going to be short projected by the Florida Hospital Association, 60,000 nurses and almost 20,000 physicians. So there have been a lot of targeted investments by the state into the nursing workforce, into graduate medical education to train our next generation of doctors as doctors continue to retire and age out. So I think when you take away coverage from these folks and they continue to come in and they're uninsured, we're still going to care for them, like she mentioned, due to EMTALA, but also it's our commitment to the community, right? But those costs go somewhere. So when we're looking, down the line, the state's going to say, okay, well, if we're having to increase uncompensated care costs and payment to hospitals that way, or help, patch this hole, maybe we take away some of this investment that we can't afford anymore in training that next generation. So that could be another potential long-term effect when we know there are labor shortages now and that are going to get worse as Florida continues to be that great state that people want to move to, and we won't be prepared for that in the future.
So this last question is very education pipeline specific. How are EPTCs helping your students, especially those entering nursing and allied health, to stay healthy and in school?
That's a good question. I don't know how many of my current students that are doing their clinical rotations in my hospital are actually covered by this versus still on their parents' plan, who also might be covered by this. So I think it kind of goes back to the fundamentals that Brewster said. A healthy workforce is a productive workforce. And the more we can do to keep them covered, I think the better. I think when I look at a lot of my physician workforce, they are private practice physicians that are small business owners. So when I think about the implications to them, or maybe the nurses that work in their office or the allied health professionals that work in their office, I think there's some pretty significant consequences there.
Yeah, I think you kind of mentioned a population that's interesting because they might have aged out of their parents' plan. They might not be receiving a salary at the time. So it's somebody that might choose to go without, right? I'm young, I'm healthy, I'm putting myself through nursing school, what have you, and they might choose to go without. And I think that, again, you talk about that workforce, goes away if they can't make it to work because they're not healthy and they're not thriving. So I think that could certainly be a gap, and we could see the impacts to the pipeline as well.
Yeah, and also, thinking about it, there may be a lot of nursing students out there who are wanting to go into nursing school, who are in the middle of nursing school, and if they don't have, health insurance, they might say, I'm done doing this. I'm going to go out and find a different job, go out and, work for an IT company or whatever it may be, and just get out of nursing as a whole. And I don't think, talking about the shortages we have now and the shortages that are projected in the future, I don't think any of us want to see a bunch of nursing students just say, I'm done with this. It's not worth it. They may be going into a teaching hospital and seeing the stress and the load that is already on the nurses who are out there now and saying, I don't have health insurance. I can go over here and work for Comcast or whoever it may be and have health care provided to me. I'm just done with this profession as a whole, which I don't think any of us in the state of Florida need.
And I can absolutely see that when we sit here each fall and spring and we have our nurses pinning, and you see that as many as half of those students are non-traditional students. They're coming back to college much later in life. And when you think of that additional burden that, our Pell Grant and scholarships and things like that, healthcare is an expense that we often overlook that's so important to both them as a student, and many of them have families and children and often are a single parent. So I can definitely see how this would impact them. So this, oh gosh, we still got some more here. From your work with local healthcare partners, how do you see the connection between affordable health coverage and solving the workforce shortage?
I think I kind of touched on that in, having a healthy workforce is going to get people out there, get them back on their feet if they have had a long-term illness or if they've been sick, and getting them back into the job market. A healthy workforce is a productive workforce. And making sure your workforce is productive is what keeps businesses going. You can't necessarily go into a store and have one person trying to deal with 30 customers because half their workforce is out sick. People will not go back into that business. So I think, we've said this well before, this tax credit. A healthy workforce is a productive workforce. And I think most of these employers out here, especially your small businesses, they're family members. They've watched their employees' kids grow up. They have then hired the kids who have, worked for some of their parents maybe. And they care about them. But I think, having a healthy workforce is a productive workforce, and having a healthier workforce getting into to fill these job openings is really what's going to help, these Florida businesses survive when a lot of them, are simply closing their doors because they cannot keep up with rising costs of labor, rising costs of healthcare, rising costs of materials. So having somebody in there working on the job, a healthy individual, helps keep businesses afloat.
Indeed. I know in a few minutes we're going to take some of the questions from the audience, but to wrap up the questions we've prepared together, if you could each leave this audience with one message about EPTCs, what would that message be?
I would say the message is they're working. This is a part of the Affordable Care Act that is working, and individuals in this state are utilizing that, and they're getting off of either going bare, they're getting off of potentially Medicaid, which is state funded, and getting into a good private healthcare provider plan that is giving them the care that they need. And I think, if you could walk away with one thing, is this is working. And why do away with something that is working and potentially leaving 4 million plus Floridians having to make very, very difficult decisions? It's just not necessary at this time.
Yeah, and I think Florida's enrollment in the ACA since the advent of these EPTCs is, it's gone from 2.5 or so million to well over 4 million, as we've talked about. It's more than doubled. So to Bruce's point, it is working. And for the personal level, it's all about access. As these folks are coming in, they're managing their medical conditions, they're having coverage, they're living healthier, happier lives. And these are our neighbors. They're not folks that aren't necessarily working. Like, these are working class Americans. And this is just the best way right now that we've got set up for them. So for us to potentially pull the rug out from under that, I think would be a big mistake for hospitals, the business community, but I think, a thriving community as well.
The only thing I would add, I agree they are working, but I think it's important for us to do this grassroots effort to educate people on how they're working. So we are subsidizing this so that they are affordable for the consumer. You mentioned the expansion of the Affordable Care Act that happened around the same time as COVID. We faced the world's largest health crisis, and our response was to pass these enhanced premium tax credits so that more patients would have access to affordable care. We took it forward, it is working, and it has the ability to stop working if we don't raise the awareness now. Again, people do not realize that their premiums are being subsidized by these enhanced premium tax credits. So I think that's the messaging right now is if you like your plan, if you want to keep your plan, then we need to extend these tax credits.
Thank you, Sally. I have a few questions now from the audience. The first one is for Brewster. If EPTCs expire, we are talking about billions of dollars impacting businesses. Have you seen a lot of advocacy from businesses yet on this?
Some, not near as much as I think we need to see. And I think a lot of it goes towards that the employees don't realize that they're utilizing these tax credits. I'm hearing some from our larger members who are worried about, some of them not even utilizing this, that are aware of it, but that, by pushing more people into potentially uncompensated care is going to increase the cost of their health care. But I think, I'm hearing from some, but like I said, not near enough. And I think it's incumbent upon us within the business community to really get that message out there that, we need to be working on this. I'll sit on a few national boards with different trade association heads from across the country, and I'll ask them on our monthly calls, are y'all hearing about this from anybody else? And a few of them have. I mean, one of the young ladies on our board heads the Oregon Hospital Association. She is very well aware of it. The Hispanic Chamber of Commerce in Nevada is very well aware of it. But a lot of other ones just haven't heard. And I don't know, how we best go out. I mean, obviously forums like this. I just approved 2 op-eds and a letter to Congress this morning, in just beating that drum more and more. But, it's something we have to, as, the business community, really have to get that message out there. And like I said earlier, not just for the employers who are utilizing this for their employees, the people who aren't too, because, if this goes away, cost of healthcare has a very real chance of increasing in the state, and that's a very big budgetary issue for a lot of our members.
Indeed. Thank you, Brewster. The audience has a question for John as well. As a political challenge, what is the issue here? Why haven't we heard more from federal elected officials?
Yeah, I would say part of that is a result of everything going on nationally right now. There's a lot of different fluid conversations. We've moved really quickly into, the Trump's second term. There's been a lot of moving parts on executive orders, a lot of interest in various healthcare things. You talk about the kind of the elephant in the room, reconciliation and activity there. So I think it's partially, it's about, it's not top of mind quite yet. Nobody loves a deadline like Congress, and these don't expire till the end of the year, so I think that's a portion of it. But to that point, a decision will have to be made at the end of the year, and I think the big hurdle is informing people, and we've all kind of touched on it in forums like this, getting out in the community, letting plan members know if I'm the insurer, or, for us, letting our patients know this potential impact, letting them know so that they can reach out and let their members know how they feel about it and how valuable this is to them and their family is the big thing, because a lot of folks don't see this. It goes directly to the marketplace plan. It's not a payment that goes to the consumer and they send it over. So it's not in their mind, but it is making a big difference in their life. So informing them so that they know, and then making sure they're advocating. But I think it's going to take all of us, right? The business community, it's going to take the hospitals. It's going to take a big coalition to push this across, but there is certainly bipartisan interest. You've seen, a couple senators that are up for re-election, but also senators that have supported him in the past. You look at Susan Collins in Maine, who's a Republican that's been in support. Lisa Murkowski has already publicly talked positively. And then Tom Tillis, in a purple state in North Carolina, states that it's expanded Medicaid. But he's also said, look, we got to kind of figure out a way to help get these across. So I think once we get past some of the other stuff, it'll be more top of mind. Congress knows they'll have to do something about it. And that's when we'll come in and we'll say, look, you guys really need to make this happen because this is what it means for our communities.
Thank you, John. And last, Sally, if you could just talk about the sense of urgency around EPTCs. We know time is running out. So if you could just close with talking a little bit about that.
You know, I think the consumers will start to feel it in the fall when they go to renew their premiums and realize that it is not the same that they're paying now. So although we talk about the expiration at the end of the year, I think it will hit us sooner. But I think the good news is we are sitting here at the end of May. There is still time to act. There's time to raise awareness. There is time to reach out to your local representatives and make this an issue that they care about because it's important to the constituents. You know, we've talked a lot about, trying to prevent patients from using an emergency room as their primary care doctor. I don't think we've talked at all about what happens after somebody has a life-altering injury that comes to a hospital that is uninsured and the care that they will need after post-discharge. And so that is the other area that I just wanted to mention before we close, that, you know, this isn't just about preventing the admission. This is about giving people access to care as well that have had, like I said, life-altering injury or illness that will require a lifetime of care. And if they don't have insurance, or let's say they have Medicaid, if we choose that to be the solution, how are they going to find a provider that can actually provide that care for them that they need? I think this is an important issue that we just need to continue to raise awareness on.
Well, I would like to thank all of our incredible panelists for sharing their insights and experiences today. Thank you to all of you who have joined us today. We've heard how enhanced premium tax credits aren't just numbers on a page. They're access to care, workforce stability, and opportunity. The conversation doesn't end here. Whether you're a healthcare leader, educator, small business owner, or simply someone who cares about your community, your voice matters in this fight to protect this critical support. Thank you again, and we look forward to hearing how this plays out. Appreciated you guys being here today.
Thank you for having us.
Thank you.